Nationals are still being blocked from accessing public healthcare facilities in parts of the province. Activist groups insist that scores of undocumented immigrants have overburdened the system at the expense of citizens. Officials have criticized it, expressing concern that the action could deepen social divides and compromise efforts to control the spread of disease. Newsroom Africa's Veronica Machwadi is live for us now from Crown Gardens Clinic here in Johannesburg. Veronica, good morning. What's happening where you are?
Well, Iman, this has been an issue that has been going on for some time now. In fact, it's nearing 2 months, and it continues to be an issue for many foreign nationals who are trying to get access to healthcare services. Today, in fact, in Gauteng, the Provincial Health Department is on a massive vaccination drive to immunize essentially children against measles and rubella. Of course, given the fact that the province continues to record an increasing and a very alarming number of measles cases since about 2022. Today, we came to various clinics. We started off in Rosettenville, and today we are here at the Crown Gardens Clinic, where we saw scores of women as well as families carrying their children away from the gates, being turned back after coming to us to immunize their children. I'm speaking and I'm standing, in fact, with one of those that were turned back, his family, 2 young children that could not get access to health care. And he's just going to talk a little bit to us. Thank you so much for your time. Just walk us through what happened this morning as we saw you and your family coming up.
Okay, I'm here 6 early in the morning, 6 o'clock. I'm on the line. Yeah, also I'm here yesterday. I have a small children for 1 month. I will come for vaccination here. These people don't want to give inside for clinic. Yeah, even securities never do anything. Security also helping for Dudula. Dudula is fighting with us. I have a small baby. Healthy is not for Dudula. Healthy is for all country. Healthy. She's away from healthy us. I don't know what you're doing. I'm going now. I'm leaving now clinic.
But what is the plan? I can see your children are still here. There's other families here. How many of you have been turned away in a day?
I'm not only me. I have a lot of my brother, my sister is here, standing early in the morning, always carrying a small baby. These people, you don't think even for this baby. This baby, he don't know anything. This baby is even foreigner, even in South Africa, he don't know anything. This baby is born in here. These people, he don't want to enter for clinic. I don't know what I must do.
Well, Iman, we're actually going to take an opportunity just to show you essentially what happens when some of these individuals approach the gates of the clinic. We know as well, if you heard from the gentleman, they're speaking about the fact that health is free, health should be accessible, and the Constitution speaks so. But many of these groups, as you heard the individual, they're speaking about Operation Dudula, have made it very clear that they believe that the healthcare system, not in just Gauteng, but in the country, has been inundated and is severely under pressure. And essentially this has been a campaign that has been going on for some time. And while officials continue to call for access to healthcare, especially in regards to immunization, we heard today clearly a family not being able to immunize their children. We're just going to follow this individual here, Iman, who has said that he's also been trying to access this clinic for some time. It's been a month, and we're just going to see if he's able to get into the clinic or not. Just the processes that often happen here.
How are you?
I don't have ID.
You don't have an ID?
Yes.
Passport with your medical certificate to show that you can enter?
I got certificate.
Medical certificate?
No, medical certificate I don't have.
No, we cannot.
Who are you?
I'm a South African, standing up for my rights. As the Constitution, Section 21 says, if you do know our Constitution, because as you are a foreigner in our country, you should be able to know the Constitution of South Africa, the don't-dos and the do's of what you must do in the country.
Okay, thank you. When I come to the hospital, I got appointment for 1 month's kid.
Are you a South African?
No.
This is the public hospital. It serves South Africans.
I come from East Africa. I'm not foreigner.
You are South. Okay, fine. Let's
I'm not
your
foreigner.
ID.
I'm from East Africa.
East Africa.
Yes.
Okay, fine. Listen.
I come from Ethiopia.
Okay, you come from Ethiopia.
Yes.
Ethiopia, it's not South Africa. This is South Africa with its own laws. And South Africa, it's for South Africans. East Ethiopia, it's for East Ethiopians. This is South Africa.
Let me tell you, me, I stay here, South Africa, it's 18 years.
So you still don't have papers?
I'm using the asylum.
You are still an illegal foreigner.
Me, I'm not
18 years with asylum.
Yes,
that's questionable.
Yes, that is not my problem.
That is questionable.
Me, I living with the asylum.
It's questionable.
I don't have the ID. That is my problem.
Iman, these are the kind of standoffs that we have been seeing throughout the morning at the Rosettenville Clinic as well as here at the Crown Gardens Clinic. In fact, we heard information from some of the community members here that this altercation yesterday, in fact, something very similar turned almost physical with some of the foreign nationals trying to get access into the clinic. And it continues to be a campaign that is driven by some of these ordinary citizens as well as these organizations. You've also heard from the individuals where they say that this happens in plain sight of security. It happens in plain sight of staff at the clinic. You can hear, in fact, that the temperatures are being risen. There is a direct, confrontation to say healthcare should be accessible, healthcare should be free. But this campaign continues each and every morning. Individuals stand at the gates of various clinics across Johannesburg asking the question for an ID. There's even some confusion that we saw with some South Africans who didn't bring their IDs and not aware of the fact that this needs to happen. And it causes quite a lot of confusion for them. But this is the process that has been taken on. And like I said, in front view of some of the security officers that are here at the public clinic, as well as, of course, the staff who, of course, just come to do their job. But you can imagine that this is causing a lot of tension, not just within the communities, but it also does raise a lot of concerns to say if people are not getting access to healthcare.
You are here to stand and protect us as South Africans. Why are you busy protect our foreigners? While now yourself, you should be protecting this country against these illegal foreigners. Now see, exercise our constitution yet. Now you are stopping us. No. We are saying no as South Africans. We will stand and protect our constitution. What are you doing as SAPS?
At 10, these are our top stories. 28 more illegal miners emerging from the Sheba mine in Mpumalanga as police intensify Operation Vala Umgodi.
We are saying go to private hospitals. Go to private hospitals.
Every country there is a law.
Whatever medication is reserved here, it's reserved for South Africans. We do not have a place for you.
Well, as you've seen, there's some Rosettenville residents here in Johannesburg vowing to continue with their campaign to prevent undocumented migrants from using public health care. The Special Parliamentary Committee probing allegations of corruption and political interference in the police and criminal justice system elect its chairperson today. Electricity Minister Dr. Kgosientsha Ramokgopa visits Medupi and Matimba power stations in Limpopo. It's 10 o'clock. It's the second hour of Newsfeed AM. I'm Iman Repeti. Thank you for being with us. Foreign nationals are still being blocked from accessing public healthcare facilities in parts of the province. Activist groups insist that scores of immigrants have overburdened the system at the expense of citizens. Officials are criticizing this, expressing concern that the action could deepen social divides and compromise efforts to control the spread of diseases. Newsroom Africa's Veronica Machwadi is live for us from Crown Gardens Clinic here in Johannesburg. Veronica, we can see the situation seems to be escalating since last we spoke. Police are now there. What's the latest?
Yep, that's right, Iman. As we were, of course, speaking to some of the community members here, police have arrived and they have told the individuals here that have been essentially manning this gate, asking for ID documents and turning those who cannot provide any identification as being South African away. And they essentially are now pushing them away, telling them that they cannot do that, and that what mandate have they been given by which department or which authority to essentially not allow people to get access to healthcare services. Police have been here in their numbers, and what we do understand is that some of the residents that are part of this campaign to not allow foreign nationals to get access to healthcare facilities are essentially really blaming the police. They are having a standoff with them, saying that they are also not following their constitutional mandate to put South African first and to protect them. They are saying that when there are crimes happening in their communities, when they are called to certain communities, they do not arrive, but they are here. And I can tell you, ma'am, that there are about a dozen of them at least to stop people from coming into a clinic. And they're saying that, you know, this speaks volumes essentially about, you know, the efforts and the work of the police officers. I'm going to speak now to Petunia, who is amongst the community members who have been part of blocking those getting access. And Iman, if you can just see the visuals here, you'd remember these were the family members that we spoke to earlier who were denied access, and they are now going inside. Petunia, just talk to us a little bit. You were speaking to the police officer. I can see that there was a lot of frustration. There was a confrontation just moments ago.
Yes, there was. A confrontation. I'm so angry, I can't even talk. I can't even talk. Yeah, mandate, and didn't they take the oath to serve and protect the South Africans? So, like, they do not have answers for me. I even asked them about the constitution. They do not even have answers for me.
And what exactly have police told you now? I can see that there was a point where you were trying to stop another individual from coming in, and the police came to you. What did they say to you exactly?
They say that I have no mandate to do that. So I asked them if they were here, they just came here, they were supposed to come with Home Affairs. Immigration officers were supposed to be here with them. So their only job here is to open for foreigners to come and take whatever they want to take.
And there is a moment, as you said, you are quite emotional and you are quite angry. There are still questions as to why you guys, some of you as community members, continue to do this, despite the fact that they say that healthcare should be, you know, available to those that are within the country. Speaking, of course, to what the police have also said to you here this morning, saying on what mandate do you have to, of course, block some of these individuals from getting healthcare?
We stand a constitution to say that illegal immigrants cannot be served anything in our country because of they are illegal. We are talking about illegal immigrants here. While they are here, that means we are illegal. As South Africans, we are illegal in our country. They are talking about arresting us in our country while they are opening up the gates for illegal illegal foreigners.
When we were speaking earlier, when some of the people were trying to get in, you mentioned to them that you saw that there were women and children who were also trying to get healthcare services. You know, does it not worry you in regards to the fact of some of the people that you turn away are in desperate need for these services?
Now we are being pushed feelings. As South Africans, we cannot work feelings. We are putting feelings aside and putting our constitution first and putting South African first.
Are you not concerned, though, that should people not get the health care that they need, that we could see something, a far bigger impact in terms of health crisis, people, perhaps maybe even a fatality in the worst case scenario, and that they will pinpoint to you and your community members and the groups that have decided to go on to this campaign?
All we are saying, we are not refusing people health care. They should go to private hospitals. Why can't they go to private hospitals? Why can't they get their things straight, their papers straight? For instance, we have a person here who's saying that he's been holding asylum for 18 years. While you are here in South Africa, asylum for 18 years. Asylum is being, if I'm not mistaken, asylum is being renewed after 3 months. So every after 3 months, for 18 years you've been doing that. When are the right papers going to come?
Right, thank you so much for your time, Petunia. They're just, Iman, just some of the residents there that have expressed their dissatisfaction with the police's presence here. What we also know in regards to their presence is that we understand just yesterday at this very clinic, which has become quite the hotspot in regards to this campaign to block, several individuals and foreign nationals from getting help, is that we understand it was just yesterday where I believe it was another individual who got into a physical altercation with the individuals here as they tried to block them, where police, in fact, had to come to the scene. And so you can see that this is definitely one of those healthcare facilities that is definitely in the radar for the police in terms of just some of the altercations that have been taking place. But we know that for now, they have opened the gates. They have told the individuals here that they are not allowed to do that. They do not have a mandate to block people from coming in. And so we're just going to stay on the scene as well, Iman, just to get a sense of what happens next.